My topic today will focus on artificial intelligence empowerment for integrated health delivery in the pandemic. And actually, today I do not really formal speech. I just want to mention something that you know. Maybe we can have a discussion in detail. Okay. So it's about me, and actually my main job is to marketing our research results to the world. And my team, including not only in Taiwan, and we have a global team. Okay, and for this reason, I try to create some international projects, but not only bilateral, as including multilateral. That means including the many countries work together. And usually you can find data in your right hand side. But I think at that time you are still in overdue, I think, to meet each other at that time. And here show you the global team, including many country people. And actually we have some international projects from government, from university hospital, and for some funding. Okay. And also we have published some joint paper, especially on impact factor with the internet. Even during the pandemic, we try to contribute the COVID-19 knowledge. So we have published some special issues, and especially we have worked together, uniting 5 countries: Taiwan, Mongolia, Myanmar, Turkey, and Thailand, and also to publish our knowledge. Actually, in Asia, they have 2 teams. One in Turkey to the western, another one in eastern to America in Taiwan. And that year is your country 100 years. I fly back to your country 3rd time and deliver 6 speech, including Suleiman Delimir, Ispada, and Nertin Aybakan in Konya, and Istinye in Istanbul, and Croatia, and Teatro University, and UVA. And this shows some of my, I think it's very interesting with my good friend, just like my family member. And actually, this time it's my visit your country, the 7th. Actually, it's not easy to visit a country more than 3 times. If you heard some about this news, maybe give a big hand to me. Thank you. Actually, thank you. Actually, I also provide some internationalization service for the Taiwan Technical University and also for Taiwan Chi-Chang University. And here show you we just signed the MOU for the both university. And now Chi-Chang University just signed MOU with the Taiwan Technical University. And here show you the Konya. It's a very fantastic. I always cannot remember what the pizza name, but it's very delicious. Okay. And here show you last year my travel route in your country. And Croatia, I think the right director, Professor Murat, you know that. And especially very enjoy as a client. There's a very beautiful town over there, and Sivas. Okay. And yesterday is our first time to meet my 5 good brothers together. It's the first time to see everyone together. Okay, let's back to my topic. When I think about the rise of AI, I am reminded by the rise of the literacy. So a few hundred years ago, many people in society saw that everyone maybe not need to be able to read and write. The reason is very easy. We don't need the word to make a conversation each other. Back then, people was attending field or attending ship, so they don't need a literate at that time. So today, I will present 3 key for you. For the first one, we were talking about the people, empowering people. They have 2 kinds of people, physician, or you can say doctor. And another one, we will take patient together. Okay. So the second one will focus on the data. Big data, or any kind of generated data in the following time, generated by patient or by new device. Okay. So next one, I would like to present you about a very cutting edge technology. Maybe you can hear this terminology before. We call digital twin. Digital twin is just like the twin baby, and one in physical and one in virtual world. Okay. So I think knowledge is a very important thing to empowering people. So we are all thinking about the knowledge is power. Now I would like to invite Professor Siddharth. Could you please deliver a microphone? I need you to speak out this sentence. It's about the source of power. It's quite the book, Management Game, written by Professor Siddharth. How to pronounce it? I cannot read it. Could you help me? I feel studying very hard to learn English language, but for now I cannot pronounce it in a right, correct way. So power is influence, it's force, and authority, and command, and it's doing by executing, and it's another computing. Okay, that's me. So take an example. The source of power will be by transition. For the president, maybe from election in democracy society. And the vote is from how about other? This, I think I might copy it and translate in English from the Siddharth's book. Dr. Brown is perfect. It's perfect. I think it's not enough. It's not enough. The doctor have to learn something new very quickly. Okay. So according to the Cambridge dictionary about the empower, it means to give someone official or legal authority or freedom or confidence to do something. I think it makes sense. Very makes sense. And here show you, just like pencil and paper, it's a very useful technology to empower people with knowledge. So here it's about 10 years ago, from written to digital. Yes, from is a new literate. From written to digital is a new literate. But today we will think it's very hardly anyone understand the impact that. Okay, I think it's AI is happening in our daily life, right? But 100 years ago, or maybe 20 years ago, you cannot believe that, but it's happening very quickly. So let's take a look at about the healthcare setting. And here, show you The first, PESCO, is introduced by Dr. Lanek. At that time, it took, I think, more than 30 years and make it input to clinical practice. Not easy at that time. But now, it's a daily. We have a new technology with the AI and the genetic artificial intelligence tool. So our doctor, if he or she engage, he has to learn a lot about this new one. Okay, and here show you some FDA have approved a device to diagnose about the heart disease problem. So here, hospital dictionary define empowerment, the act of giving somebody more control over their own life or the situation they are in. Let's take a look at about the physician. The first one, physician is empowering patient to know something, or allowing patient to do something, or not to do something else. The second one, physician has learned a lot of digital technology. And last one, I think is the most important thing. All patients, they are being educated, have trained, not focus on disease, but patient. So we can so the many paper, many articles that focus on, we will care about the patient-centric treatment, right? So here, show you empowerment physician is a very popular at the moment, one day. And the next one, maybe you have listened my speech before. Art. Here show you medicine is art. Medicine is science. So let's focus on the prevention. We were not talking about the medicine anymore. Preventive medicine. So art and science in health, we can focus on they have a healthcare from 1 to 5 version. And the last one here show you art and science in health. We will focus on the personalization, medicine, and health. And according to the William Osler defined teacher and student that book, the practice of medicine is an art based on science. And the book not only focus on the evidence, you have to do something in care, not directly. So we will focus on the patient. So here, show you my Congress lecture just finished in Yokohama, in Japan. Next year, our theme will focus on here, advising the art and science of medical informatics with digital innovation. Okay, it's about 14 years ago, I wrote this paper. We will focus on patient prefer what kind of role. The results show you how patients prefer share medical decision making with his or her doctor together. Okay. So let's take a look at maybe our teacher can revert to the PowerPoint slide. Here show you the different generation with the different situation, especially during the developing the technology. So let's take Professor Siddharth. Which year you grew up? 1960? 58, right? Suppose it. So here, theta will be generation X, X generation, me too. Okay. So what's different in this generation? Here, our value agenda is quite different between each other. Okay. So we now will focus on digital and empowered generation X, Y, Z, and alpha, beta, gamma. Okay. So we are living in the same era, but our background, our education, our experience is different. It's different. So we call the generation X, it means digital ready. What do you mean? I don't like to use the IT, but I have to face it. I have to do something. Okay. And another one is about the generation Y. It means digital immigrant. From A to B, you can enjoy. Maybe they have some fun, maybe not. And next, digital native. Is living in a digital life, digital situation, environmental, and so on. So also, their job have facing daily tasks, have deal with technology every day. So the next one is about the technology today. What I mean? Maybe when the baby, the pregnant in the mama and in the pregnant, they can enjoy the 3D or 4D image to show he or she to the world, right? Okay. So different generations facing the different digital era. And let's take a look at about example about patient journey. Can be, for example, here show you 4 steps from left to right. First one, step 1 is about ask something, ask someone what happened, and then check anything went wrong, and then do something for good, and then finally recovery to normal, healthy body. Okay, for better. So here show you about the empowering patient journey. If we using some technology in not a traditional way, because I'm living, I show you very quickly. Here show you the group 1. You can using some Google. Maybe now you can using the ChatGPT 3 or 4, and using some app to check your symptoms and check some component type with your data, and so on. You can find any app or digital product to provide you deal with your problem by yourself. It's really fantastic, right? Sorry, because I'm living. Okay. Anyway, we'll focus on the need, the need the patient needs, or some pain point, not being slow for now. Okay, thank you. Okay, let me show you the last one about the digital twin. I will show you the last table about the empowerment, patient, and healthcare provider. Okay, trust me, it's the last line. Okay. Here show you they have the 3 colors. The last one is about the future. Future is meaning what happened to anyone. The first entity we will focus on the patient, and the right column is mean about the medical professional, facilitator, doctor. Okay, so longitudinal from the early we will have the electronic patient record. Okay, and then we have the equipment, some information technology, information system, and maybe you can think that will be automation of process. And the third is about the enable someone to do something. And here we are here in power for patient and for our medical professional. So the next one we will focus on engage. Patient and doctor have engaged the same thing. We'll focus on the very specific point. And the last one, we need some technology to provide very unique personal medical service. Okay, thank you.
Thank you very much. This is very interesting speaking for us. If you have any question, you can ask either in English or in Turkish. I translate it. Do you have any question for us? Distinguished person?
No question. So may I have question to everyone? We need more interaction. Okay.
You can also ask.
Okay. So anyone have experience ChatGPT 4 or 3? Any experience? Raise your hand. Do you have ever used the technique using to check your health situation or your disease problem before for now? Yes, raise your hand. Okay. Mister, could you take any example? Any question for the ChatGPT or something? No?
Sağlık durumumuzu değerlendiriyoruz, soruyoruz. ChatGPT yapay zeka kullanıyor.
We are not very helpful on using ChatGPT for check out this kind of health services. But we use ChatGPT especially for finding our scientific data.
The reason I asked because if you can coding, you can programming, you can developing something for AI product or coding. Now you don't need to know how to code it. You just need to something. You just write give input the right keyword. You can get an answer. Yeah.
So, Professor, I have a question. Do you think in a very near future, ChatGPT and this kind of artificial intelligence devices will take the ordinary physician work or duty? For example, for going to ordinary physician to primary care or not a special one, just trying to ask ChatGPT to check our blood pressure and everything, rather than going ahead. That will take the places. So we will reduce the physician working in the action in the health side. Do you think something like that?
If possible, maybe we can make it clear. I think you put the two things mixed together. One we talk about the literacy. Another one is about you know something and you be able to do something. You have a tool, but you don't know how to ask the right question. That would be the big problem.
So since traditional Orthodox medicine will go on by using artificial intelligence, and they will not take their job.
Yeah. Thank you very much. Thank you.
Okay, now we will give you our planet. I'm inviting who?
Rakipler vermek üzere Profesör Doktor Sedat Bostan hocamızı, Profesör Doktor Yusuf Çelik hocamızı, Profesör Doktor Şerife Didem Tay hocamızı sahneye arz edelim.
Evet, bütün seyirciler bunu geçerseniz. Bodrum belki yapar. Evet. Evet, saat 11'de başlayacağız.
Saat 11.00'da kahve molasının bitiminde görüşmek üzere.